Mon nom est Jennifer Ditchburn. Je suis la présidente et chef de la direction de l'Institut de recherche en politique publique. I'm the president and CEO of the Institute for Research on Public Policy. I'm very happy to be here for a second day and continue our conversation about les accords en matière de santé, les accords canadiens en matière de santé. Now what? We had a great discussion yesterday, kicking off with our friend Shachi Kurl, who's here again, I think somewhere in the audience, talking about the survey, the very interesting survey she did of Canadians and their perceptions of the healthcare system. Some very interesting things to draw from that, including that Canadians are very dissatisfied with provincial, territorial, and federal levels of government in terms of what they're seeing in the healthcare system, that they understand that money isn't going to achieve the system-level change that the system needs. Shachi talked about Canadians starting to be more curious, which was very interesting as well. And I know you had a discussion this morning about private versus public health care. So we have, and we also had a very interesting conversation, you'll recall, with CMA presidents past and present, and their perceptions of what were the priority areas that would really get the system to that sort of architectural change that's required. And we have Dr. Ross here again, the incoming, newly inaugurated president of the CMA with us, and another special guest is the newly appointed Minister of Health, the Honourable Mark Holland. So I'm going to get right into it. Thank you. Minister, the portfolio isn't completely foreign to you. You were an executive at the Canadian Heart and Stroke Association. You also were you were also in the House when the government was steering the budget with all the new funding for healthcare. Can you tell us what your priorities are for the portfolio in the first 60 days?
Well, in the next 60 days, first of all, thanks for the opportunity to be here. And just let me say, I'm a veteran in the role compared to Kathleen, because you're 2 days, I'm 2 weeks. So we're both very new. But no, it's a tremendous privilege to be here. Look, the next 60 days are going to be really critical. There's a bunch of things that are happening. We had the announcement last February, a historic announcement of $200 billion that's going to be put into the health system, but people want to see the bilateral agreements. They want to see the details and the action plans of how that money is actually going to have an impact in improving patient outcomes, and be able to see what are the metrics. And I want to thank the CMA, which has been really critical in pushing to say we have to have those metrics to show empirically how those improvements are occurring. So we're going to be rolling a lot of those out over the next 60 days. In Charlottetown, we have the Ministers of Health meeting that's going to be taking place. I've had an opportunity in the last 2 weeks to meet with all of my provincial and territorial colleagues, and so getting those agreements signed is huge. Getting them not just signed but understood, so people can really see how that money is going to live and change the health system. Secondly, the progress that we're making on dental care. We're going to have a lot of announcements around. We've had enormous success with the program, which is effectively a rebate type program right now, but we're getting ready to launch a national dental care program that will be available for about 9 million Canadians. So this is extremely significant. And then we have legislation on pharmacare. But overarching all of that, Jennifer, I think, is building a sense of momentum, building a sense of optimism that, as tough as those numbers that we saw from Angus Reid and Sachi yesterday, and as much as we have to acknowledge that that's where people are and what they see, that there's great room and space for optimism. And in the next 60 days, I want to start to have people feel that.
Back to the question of momentum in a moment, but Dr. Ross, what are your priorities or your wish list for the minister in the next 60 days or so? I mean, I'm throwing that out as an arbitrary.
Well, I'm going to copy you for a second, because the next 60 days are really important.
Yes.
And there's a lot happening. What we heard in our survey and what we've been hearing from patient representatives here and the people that are providing the services is that access to care is a priority. The survey really highlighted for us 4 out of 10 Canadians are chronically having trouble finding care, and half of Canadians are struggling to seek primary care. This has got to be a priority, the bedrock of our services. So understanding and prioritizing that has got to be out of the gate what we want to look for. And you're right, the CMA did put a lot of metrics in place, but underlying all of that is access. And accountability is the other piece. And I think we really want to have an easily understood, publicly available, benchmark-based way of assessing are our dollars going where we need them to go, and are we seeing the impact at the ground level, at the provider and patient interface? Are we seeing them?
Can we pull on that a little bit in terms of the benchmarking and the measurement? What can the federal, and I'm asking both of you, what can the federal government do to oversee the benchmarking? Because the provinces are all going to come with their different conceptions of whether they're making progress. And that's often been the challenge in the system, right? One province says they're doing this, one province says they're doing that, and you never have a kind of standard conception of what's happening. So whose job is it to evaluate and set a standard for, yes, we're making progress in all these different areas, whether it's team-based care, pan-Canadian licensure, wait times, Dr. Ross and
So
Minister.
my opinion is that it's everyone's responsibility. I think that we've seen unprecedented collaboration between medical associations, other professional organizations that give care, and now we're seeing more collaboration between provinces, territories, and the federal government. Missing in the middle is the way that we track and report data. So we need a standardized process that we can track data. All of us are very open about it and be able to say, okay, here's how we're going to collect it, here's where we started, here's what we did, and here's where we saw some improvement, and really openly admit when we do something and we fall flat on our face. We have to be building a culture where that's okay. That's an innovation, we tried it, it didn't work, let's move on to the next thing. What did we learn from that?
Yeah, I mean, I completely agree with Dr. Ross around defining what failure is, and we just had a quick opportunity to talk about that, because we need to engage in transformative change on a scale that we've never attempted before. Mm-hmm. And that's going to require a bunch of different things. Yes, absolutely, making sure that there's harmonized metrics so that empirically in data, people can see that improvement happening. But it also means that provinces, health systems, hospitals, doctors, nurses, innovation has to be allowed. And the only way innovation will happen is if we change how we define failure. And for me, trying something that's rooted in evidence and evaluation that doesn't work out is learning. It's not failure. And so we have to give space for one another for that kind of spirit to pervade what we do. And I really want to thank the CMA because they put a real focus on lived experience and on the experience of patients. And it's important as we're talking about this monitoring and we're having a harmonization of those data metrics, that at the same time that the lived experience of a patient is improving. It's essential that people feel that improvement because it's, there is, and you're seeing that in the numbers that you're talking about, a lot of people who are losing hope, losing that sense that things are going to get better, so they have to feel it. The numbers alone, as much as they're essential, and they have to be visible, and you need to be able to look from province to province to see how money is being spent and how that's actually having an impact on health, we need to ensure that folks are feeling that on the ground as well.
So I think it's fair to say probably there's people in this room, people that work in the, broadly speaking, the policy sector, like myself, there's skepticism around the money being out there and whether it's actually going to be spent the way that it should be, or that there will actually be constructive change. How would you hold the provinces to account in the long term for living up to their agreements?
Well, I'll start, and we had a great conversation, a bit of a roundtable to start my time here. Tim Green, who's the head of the Canadian Nurses Association, said something I think is really powerful, which is that Canadians are not going to let us get it wrong. I think that one of the biggest points of accountability, particularly when these metrics are in place, is that Canadians are done with turf. They're done with politics. They're done with excuses around jurisdiction. They want to see results. And I think that, I think what I can say, what is so encouraging to me, is that is understood, I think viscerally. You know, I've had really good, some in person, some virtual, but I've had an opportunity to talk with all of my territorial and provincial counterparts, and they are on the same page. You know, we talk about taking a team approach to healthcare being the best way to tackle the challenges that are in front of us. You know, Canadians don't expect, they demand that governments take the exact same approach. And so we have to be singularly focused on that. And I think, you know, we have to start with the goodwill, the words that are being said. I mean, that's going to be demonstrated in evidence. And there will be some provinces that will be leaders. And I think that we celebrate that success. We advocate for those successes to be replicated elsewhere. We recognize these numbers, the evaluation, that feeling of momentum. I think that the Canadians, where they see it happening in certain jurisdictions, will demand it in others. There will be leaders, and there will be others that are falling behind. But I'm very convinced that that spirit and the demand that's coming from Canadians is going to ensure accountability along with the data.
Dr. Ross, what do you think could be done by other actors to encourage the provinces and territories to be accountable to their promises, to fulfill some of the elements that are going to be contained in these agreements?
So it's a great question, and as I said, my opinion is that it's everybody's responsibility. We're all of us citizens. We heard this morning in our discussions about the balance between private and public, that it really is a value. Our Canadian healthcare system is a core value to Canadians, and we all have a responsibility in doing this. How do you do that? If you are a patient, you can talk to your care provider. If you are just a citizen not currently engaged in the health system, where we will all be, then talk to your political leaders. We can certainly keep asking those hard questions, and we need to keep asking those hard questions and digging deep when we're not getting the answers that we need. And instead of covering and hiding where things aren't working, we should be showcasing that, going, okay, what can we do about this? Right?
What are some of the priority areas, Dr. Ross, that you'd like to see the provinces and territories focus on?
So last month, the CMA released a fairly comprehensive list of what we would, think is attainable. And I was asked in an interview, oh, this is a great list, but do you think it's actually doable? Yes, I do. I have a tremendous amount of optimism. I think the time is now. 60 days is a bit of a tight timeline, but I think that the time is now, and we're on the precipice of reforming how we deliver care, and you can even say how we're defining care, including those things in the basket as we heard this morning: dental care, pharma care, physiotherapy, physical therapy, if it's needed, and home care critically. We need to look at all of those things. But our targets were not rocket science, if you put it that way. Eliminating all the emergency room closures in the next 3 years, ensuring that people have access to a family health team or primary care team. 90% of Canadians in 5 years, 95% in 10 years. This isn't untenable. Looking at having our surgical backlog cleared to the point that we're meeting benchmarks that were established back in the 2000s. We're not asking for the moon and the stars here, simply looking at what is reasonable for Canadians to expect from their care.
Thank you. So, Minister, you were talking about momentum, which is encouraging, I think, to the people in the room and others that are working in this general sector, because there's a feeling that maybe once the money is out the door and the big announcements are made, that the attention sort of drifts. Because the ensuing work is not as glamorous. There's an election that's sometime in the offing in the next 18 months or so. How can we be certain that the attention is not going to drift to all the other myriad challenges that the government's going to face? I mean, thinking about just today and the catastrophic fires that are burning in BC and the Northwest Territories, is it possible that this will just become a lower priority item in the next 4, 5, 6 months?
Yeah, I think so. Going back to the roundtable discussion we had, and Dr. Sharp, who was the past president, said this is too important to fail. And yes, there's going to be a lot of things that pull our attention in other places and have to. You know, I had a conversation with somebody just at lunch who was talking about, you know, their family and friends not being able to leave the Northwest Territories right now. You know, and that evacuation that's occurring, the devastation that's happening there, the fact that some folks are going to come back and not have a home, you know, how could you not be gripped by that? But everything comes back to health. You know, when we talk about economic portfolios, as an example, health isn't really tossed in the mix. But how do you innovate? How do you have a productive workforce if that workforce has serious mental health challenges and physical health challenges? How do you deal with the existential threat of climate change if we're not healthy to meet that threat? And frankly, how does health play into that? You know, that a declining planet with worse air and extreme weather events is going to have incredibly injurious effects on our healthcare system. You know, in Northwest Territories today, what are we doing with the folks who, you know, have been evacuated and they can't go to healthcare providers in their home jurisdiction? So in every single facet, you know, I'll take my time. I was a critic for public safety and national security. I visited every federal penitentiary in the country. 80% of inmates have addiction issues. Addiction issues are fundamentally a health problem. Mm-hmm. So it doesn't matter what line you draw where, health is at the center of it. So if we don't deal with health, if we don't tackle the crisis that we have with mental health and primary care, and ensuring that we reduce backlogs and improve patient outcomes, then those other problems aren't going to repair themselves either. So for me, it's a very clear and easy guiding star. The last point I would make, I think, and we had this conversation as well about the pandemic, and that I think, you know, the entire country, the entire world was focused on health and healthcare in a way that it really never had been before. And I still think there's a lot of momentum to that attention.
I find that interesting because I mean, we've heard many stories about, you know, how the premiers met weekly or more frequently, that coming together during COVID, but also hearing about snapping back to old habits, and when people are scrambling to just keep an ER open or put Band-Aids on things so they can just keep the system afloat. Their first priority might not be data sharing. Their first priority might not be, let's get the foreign credentials issue sorted out. So that's where I'm just interested in how you're going to keep that focused attention on the items that are not where Canadians' first mind goes to. And Shachi's survey pointed to, for example, the #1 thing being able to access an ER, where access to primary care is probably one of the key issues that, for example, the association's interested in. So it's a long-winded question, but is it possible to keep the province and territories and the federal government focused on the items that are not, I guess, as urgent and are more architectural in nature?
Yeah, I mean, it's a great question, and I think the answer is, you know, I think I play a really important role in being on the road all the time. You know, in my first 2 weeks, I've been in British Columbia, I've been in PEI, I'm obviously here in Ottawa, I'm in the GTA, and we're planning to have me on the road all the time to continue these conversations face to face, to meet with the stakeholders, the patients, the healthcare providers, the doctors, the nurses, with everybody to hear their lived experience directly. And so that I can advocate and be their voice in that, and to keep it real and keep it alive. I think what happens is, you know, and I was the whip for over 3 years, so the chief government whip is responsible for holding people to Ottawa. Well, as the whip and the House leader, I was in Ottawa all the time for 5 years. My role here is to be on the road all the time, and to be right in the trenches, seeing it, feeling it, and having those conversations directly, face to face, with my counterparts, and to keep that pressure on. And I think what is really great about the launching of these action plans and the bilateral agreements is that because we're going to have that harmonization of metrics, we can see what's moving and what's not. Canadians can see it in the data. We can lean into that. And there's the opportunity to see, and having those experiences, what innovations are working, what might be applied to other parts of the country, and yes, what isn't working, right? I mean, that is the whole spirit of the Enlightenment, which is I was talking about earlier. And somewhere along the line, we've lost the spirit of the Enlightenment. There's nothing wrong with admitting something isn't working, right? To say we can't do this anymore, or that we tried something and that it failed. That's where learning comes from.
So what would success look like for you?
Well, success for me is very simple. You know, if you look at what Sachi presented from Angus Reid, we have to turn the tide. We have to have people have optimism and hope in our health system. We have to have them feel and see in numbers, see in data, see in evaluation that improvement is happening. But we have to have them feel that as well. And you know, one of the things we talked about that I think is really important to me, and in my closing remarks I'll touch upon it, is that direction. You know, there was a nurse in PEI who is in a rural setting, you know, really on her own holding up the world and doing work that is, you know, it's just hard to listen to because because how much she's holding up. But she's not asking for the system to be reformed and changed overnight. I don't think Canadians are either. What they're asking for is, what, in her words, a light at the end of the tunnel. Show me where we're going. Show me it's getting better. I think that, you know, the enemy here is a feeling that things are getting worse. Mm-hmm.
Which your political opponents are playing up on, right? Which I'm sure will be an issue that arises in the next 18 months. Dr. Ross, do you have an idea of what you think success will look for the government in the next while?
I'm just going to touch on the light at the end of the tunnel, and I can't remember who said it to me yesterday, but it was absolutely brilliant. But the saying was, due to budget cuts, the light at the end of the tunnel has been extinguished for the time being. And that's a little bit how it's felt for the last more than 2 decades that I've been working in health. So what would success look like? Success for me would look at my ability to deliver care at a grassroots level where I can say to a patient, you need this medication, you need this investigation, you need this treatment, you need this referral, and it's all going to happen within the foreseeable future. Success to me is not going to have that young breast cancer patient that wound up dying because we couldn't get her investigations done, we couldn't get her treatment done. It's going to look at not losing one of my best friends a year ago because she couldn't afford the chemotherapy that wasn't covered. It's going to look at keeping the elderly patients where they want to be at home with their supports wrapped around them and not in the long-term care. So these are all personal stories that say, okay, we've gotten there. Now, I completely agree with you, and we've talked about this. One of my new favorite quotes is by Thomas Homer Dixon, that people who are in despair are not going to get up and solve your problems. And I think we have to come at it with that sense of optimism, and that something is going to change. But at the same time, when you have a high percentage of Canadians that are so pessimistic that anything's going to change in 2 years, and slightly lower, but maybe it's going to change in 5 years, we need to keep speaking from the heart about the stories, about how that actually influences things. And the timeline, if you look, and it's absolutely critical that we look at this beyond the next political cycle. The metrics that we put in place, that we proposed, trying to inform the action plans as they come out. It's not, okay, by next election cycle we want to have this. It's in 5 years we want you to set this. In 10 years we want to set this. And we need to try and uncouple those long-term reformative innovations from the political cycle.
Totally agree. Yeah. Totally agree.
Minister, we're just about at time, but I wanted to ask you about pharmacare because you raised it. And obviously there's a lot of political implications to that plan. It's part of the agreement that the government has with the NDP, that there be some kind of plan before the end of the year. So could you fill us in on where that's at?
For sure. Well, what I could say at the highest level is I'm not going to give you as much detail as you want because those conversations are ongoing. But I will say we are committed to introducing legislation in the fall very soon, and that I had a great conversation with both Don Davies and Peter Julian. I'm looking forward to having a conversation in the very near term with my counterparts in the Bloc and in the Conservatives. But I can say, you know, I just came from PEI, where we had an announcement on the remarkable success of the collaboration on pharmacare that we have in PEI, where 60 drugs were added to the formulary. We're able to bring the copay for 60% of the drugs folks are using down to $5. It's resulted for Islanders just since June in $675,000 in savings. And I think that that's a really good example of how collaboration between the federal government and the province is going to lead to really great results. Now, we've also taken action with new regulations on patented drugs that are going to make a big difference. We have $1.5 billion that has been put into the rare disease strategy that's there for drugs. So we're doing a lot of things in the pharmacare realm, and I know that everybody's looking forward to that legislation that will set some of the framework. But as I can tell you from my time as the leader of the government of the House of Commons, those are dynamic conversations that are moving, and so I wouldn't want to be prejudicial to them.
And on dental care, just as a last question, can you fill us in a little bit on where that's at? I know that there's been a lot more movement on that than pharmacare in recent months, but.
Yeah, sure. I mean, I really want to thank the folks at Dr. Stephen Lucas is here, who's the deputy with Health Canada. You know, his team at Health Canada has really made miracles happen in many ways for us to be as far along as we are. The plan that we have right now, which rebates Canadians for children under 12, has helped over 340,000 children in the first iteration. In the second wave, just in the last couple of months, we've seen over 100,000 helped. And we're gearing up for the national plan. As I mentioned earlier, that's going to be impacting around 9 million Canadians. You know, and this is not only a commitment that we made in the Supply and Confidence Agreement, but you know, when I hear things, when I'm talking to folks, and you hear that the number 2 cause for children being in a hospital for a surgery is oral health, and almost all of that is preventable. You know, there are huge consequences for prevention and taking action on dental. And, you know, and it's one of the things, and I see we don't have a lot of time left, but I'll say it's one of the things that we need to think about generally, that you know, a lot of times when we think of the advancements that we've made in the Canada Child Benefit and how that's vastly reduced poverty, you know, over 2 million less people in poverty, hundreds of thousands of less children in poverty, that the socioeconomic benefits of that to the health system are enormous. You know, so when you talk about cuts and you talk about, you know, you have to think about the impact of the other actions we're taking to reduce poverty, to take action on dental care, to take action in the preventative space, to ensure that we reduce costs upstream and avoid the cost in the system as well.
Thank you, Minister Holland, and thank you, Dr. Ross, and thank you to you all for your attention. Thank you. Thank you. I'll now invite our friend Adrian Harewood back to the stage and enjoy the rest of the conference.